Hello, my name is Tao Petovsky and I am a student pharmacist here at Solomon University. Today we got a patient, a 2 years old African American female patient presented to the emergency room after a referral from her oncology doctor for febrile neutropenia. Her chief complaining was, I feel bad. She recently got diagnosed with acute lymphoplastic leukemia last month, and she is currently on her induction phase of her chemotherapy. Family history, there's really nothing pertinent to her medical conditions. Her mom have type 1 diabetes and her father have hypertension. Social history wise, she lived at home with her parents, her brother and sister, and they have a dog and 6 chickens. Rather than that, nothing else pertinent either. She has no known drugs allergies. She is currently taking Bactrim 240 milligram per 5 milliliter, and she doing that 3.3 milliliter twice daily on Saturday and Sunday. And then she's also have chlorhexidine 0.12% oral solution. She taking ondansetron zofran 4 milligram 5 milliliter oral solution. She also taking dexamethasone, famotidine, vitamin D, and calcium supplement. She is currently up to date on all of her vaccination. She presented to the emergency with a fever of 39.4 Celsius and redness around the port site. Her blood pressure was 100 over 58, heart rate of 110, temperature was 39.4 Celsius, which is 102.9 Fahrenheit. Her respiratory rate was 25, height is 73.7 centimeter, weight of 10.5 kilogram. That put her BMI at 19.3 and her BSA of 0.46 meters square. Lab wise, everything looks fine except for her serum creatinine of 0.54, which is low, her hemoglobin of 11.8, hematocrit of 33.8, white blood cell count of 3,000, SAC was 2%, and band form was 1%, and all of those are low. I calculated her creatinine clearance and it's 56.4 milliliter per minute, and her ANC, her absolute neutrophil count was 90 neutrophil per microliter, which is put her at profound neutropenia. So the problem, so we're gonna diagnose her with febrile neutropenia, and it's evident by her oral temperature of 39.4, which is greater than 38.3 per guideline, and her ANC of 9, which put her at profound neutropenia. She is considered at a high risk criteria. She have redness around the port sign, which we're gonna suspect catheter related infection or maybe soft tissue skin infection. So we need to cover have an MRSA coverage for this patient as well. The goal for this patient is that we're gonna prevent any morbidity, mortality. We're gonna eradicate infection if there's any, and we're gonna relieve sign and symptom of her fever. So I think my recommendation is gonna be, we're gonna put her on cefepime, 50 milligram per kilogram per dose, and that's gonna put her dose at 525 milligram IV. Because of her renal function of creatinine clearance of 56.4, I think we can play safe and put her every 12 hours until we get a negative blood culture for 48 hours, and she need to be afebrile for at least 24 hours. And there should be evidence of bone marrow recovery from this medication as well. We need to watch for local IV infiltration, skin rash, nausea, vomiting, diarrhea, and we're definitely gonna need to watch for her creatinine clearance, her renal function. For this medication, for efficacy, we need to monitor for improving of symptoms. So we need to see she gonna go down on her temperature, her white blood cell, and her neutrophil count need to recover. Monitor for serum concentration of the drug as well. And So then that is for the cefepime. And then I also think that she need to be put on her vancomycin, which is gonna help cover the MRSA, potential MRSA. And the dose for this patient is gonna be 160 milligram IV every 8 hours. And again, the duration is gonna be until she is afebrile for at least 24 hours, and we can discontinue this after about 2 to 3 days if she's afebrile. So for this medication, safety and toxicity, we need to watch for red man syndrome. And if that happens, we need to slow down the infusion rate, maybe over a 90 minute to 120 minute. We need to watch for a granulocytosis, hypersensitivity, reaction, myalgia, and especially also toxicity. For efficacy, we need to monitor for improving of symptom as well by temperature, white blood cell count, and recovering of bone marrow. And we need to monitor for blood serum concentration. Overall, with the two medication, I think, and with her condition, I think it is also important to monitor her for respiratory symptom and blood pressure issues, in case she's gonna go into sepsis. And that, if you have any questions, please just let me know. Thank you.